I'm currently working on the response assessment in metastatic colorectal cancer patients treated with regorafenib monotherapy. And regorafenib, it's a multikinase inhibitor that is known to have moderate overall survival benefits, and this comes along also with significant adverse events. This is the reason why it's crucial to be able to distinguish non-responding patients in order to spare them from unnecessary toxicities. And in this context, the prospective clinical trial named Kehagias aims to identify these non-benefitor patients assessed by metabolic imaging, but also combined with an early circulating tumor DNA monitoring profile. And so for the transnational part of this study, we selected archival tumor tissues, but also plasma samples before treatment and after 14 days of regorafenib treatment. So we started with a preliminary study to ensure that we could identify tumor-specific mutation in plasma samples by targeted gene sequencing, but also droplet digital PCR. And our results on mutant allele frequencies were correlated between both techniques. And we were also able to monitor ctDNA levels in plasma samples by droplet digital PCR. However, we raised an issue when we interpreted droplet digital PCR data because depending on the metrics that we used, we obtained different results. It was a bit tricky. So, in fact, we observed that wild-type copies were not constant through plasma sampling over time, and because the number of wild-type copies was higher after 14 days in plasma samples after 14 days of treatment compared to baseline, and showing that it was we had a bias on the mutant allele fractions. Next to that, after all this interesting data, we decided to extend the study on the remaining available patients, and among 96 patients, we could identify as the most commonly mutated genes TP53, APC, KRAS, and PIK3CA. And we were also able to monitor ctDNA level in plasma samples before and after 14 days of treatment, based on a selection of 2 tumor-specific mutations on average per patient. And here again, we observed that wild-type copies were higher in plasma samples collected at 14 days after treatment. So we decided to interpret ctDNA as the mutant allele concentration, meaning the absolute value of mutated copies per ml of plasma. And next to that, we investigated the prognostic value of the ctDNA level changes between baseline and after 14 days of treatment, so regorafenib treatment, and we calculated the optimal cutoff value of 50% in ctDNA level changes, and we observed that thanks to that, we separated patients according to the presence of at least one increasing mutation, and we observed that patients with at least one increasing mutations compared to none had a worse clinical outcome in terms of progression-free survival with a difference of 16 weeks, but also overall survival with a difference of 22 weeks. Yeah, so actually, to date, we are the first to provide strong evidence that an early circulating tumor DNA monitoring profile, that is to say only 14 days after treatment initiation regarding regorafenib treatment, can describe correctly clinical outcome of metastatic colorectal cancer patients. And also, we believe that early circulating tumor DNA monitoring in patients can become a major tool for metastatic colorectal cancer, but also colorectal cancer management, and also a viable approach to analyze early tumor evolution, but also tumor treatment response. As I said, we just obtained the results on the transnational part of the study. So now we aim to correlate these kind of results, so the circulating tumor DNA profile, with metabolic imaging. So we want to see after 40, because we performed a PET scan analysis at baseline and after 14 days of treatment. So now we want to correlate these parameters to see if we have any correlation between them.